About a month ago, I did a video talking about a change in my medication. The doctor, who I hadn't seen in over 2 years, basically decided it was time to change up my medication because I'd been having a lot of lows. That's been a problem for me for probably at least 6 to 9 months, and I've been seeing her nurse manager, or whatever the thing is she's called. Maybe she's a PA, I don't really know. Anyway, I've been seeing her, and she had tried to lower the dose, and I guess I was still having some issues, so the doctor decided we're going to switch medication. Now here's the thing. I hadn't seen her in over 2 years, and even though I make the assumption that she knows what she's doing, I really hadn't talked to her as much as I had talked to the PA or the nurse assistant. I'll figure out which one of those I'm going to use later on. Anyway, I was actually on work time. I had gone into the office. I, got some stuff together. And then I had already told the manager that I needed to leave for a while because I had this appointment before I started the job. And, what's she going to say? She knows I'm older. She knows that I, have certain appointments. So I went ahead. But I didn't think it was going to last 2 hours, which it did with her. And then I spent another 30 minutes meeting with another nurse who wanted to tell me how to use the new Dexcom G7, which I'm not going to talk about. Anyway, because time was moving on and, I'm really anxious to leave, I never thought to ask any questions about the new medication. I was barely listening, truthfully. My mind was, when's she going to end so that I can leave? Now, we talked about a few things here and there, but I never asked her about the new medication. So, that same week, because I met with her on a Thursday, and on Friday, the new prescriptions were called in to the store that I get my medications from. And I go there and I picked them up Saturday morning, or at least I picked up one. And that was the Trulicity. So I don't work Mondays and Tuesdays most of the time. And I decided I'm going to start taking the Trulicity every Monday. Now, I also got the Lantus, which you take every day, but the Trulicity you take in the morning. Once a week. So I took the Trulicity. Didn't think anything about it. 0.75 milligrams. Took it. Didn't mean anything to me. Then, probably 2 weeks later, maybe even 3, I got to one of those periods of time where I was eating a lot less. I wasn't really hungry all the time. And I wasn't sure why. Because, I know that when maybe my mindset is in a bad place, I don't want to eat. But I would still get hungry every once in a while. But in this case, I wasn't hungry. And I started wondering, well, this is something different. Am I having issues? My stomach was a little bit upset. And I found out that was one of the side effects. So I just thought, maybe it's just, something that's going on with that. And then I got a call from one of the nurses to the doctor saying that we were going to double the dose. So it went from 0.75 to 1.5 milligrams, which I understand is kind of a thing that they do. A lot of doctors who recommend the first one, they want to increase the thing. I still never talked about it. So what happened is I took the higher dose on a Monday morning, and by Wednesday, I wasn't hungry at all. As a matter of fact, the thought of even eating anything just made me feel sick to my stomach again. Now, I knew about the nausea, but this was something different because when I wasn't eating, my glucose started to drop. The reason I'm supposed to be changing medications is because of the lows that I've been having with the other thing. Well, now I'm having the lows, but I don't want to eat anything to try to take care of the lows. I mean, I remember one day where I had a low and I knew I should go eat, but I was so exhausted at the same time that I took a nap and I slept for an hour and a half. And when I woke up, I still wasn't hungry. But I knew I had to eat something because, crashing is a horrible thing for diabetics. So I ate something, and then I decided that Thursday, I said, maybe it's something with the medication. I don't know why I hadn't thought about it before, but I just thought about it one day. So I go and I look it up, and one of the side effects is decreased appetite. And that's supposedly a big one. I guess that happens to a lot of people along with nausea and vomiting. Yeah. I had the nausea, didn't have the vomiting, didn't feel like vomiting. I wasn't eating anything, so that probably knocked out the vomiting thing. But I said, whoa. And then, as I was doing more research, they were comparing Trulicity to Ozempic. Well, I had been telling the nurse manager for a couple of years, I don't want any Ozempic, because I had heard about people losing weight from this thing. I had already lost 70 pounds. I'm not a big, heavy fat guy. Heavy fat guy? Heavy weighted guy. I'd lost 72 pounds. And I was, pretty confident, happy with the weight I was at, but I still wanted to maybe lose something, but I thought I wanted to lose something fast. But in the time that I started taking the Trulicity until, the time when I heard they were going to double my dose, I lost 5 pounds. And I'm thinking, wow, that was something else that made me wonder, why am I losing so much weight? Oh, because I'm not eating. That's just my thought. Well, you know what? I didn't want this kind of medication doing anything to me like that. And so I sent something through the portal to the doctor's office saying, okay, I didn't know that this thing was going to, give me a loss of appetite. I don't want to take anything that's going to make me not want to eat and make me lose weight. I'm having crashes that I don't want to take care of. This has to stop. I'd like to hear what you have to say. Now, I still haven't heard back from them. So, I actually sent that in on Sunday when I knew they weren't there, thinking I would hear something. I'm doing this video Thursday night. Haven't heard anything yet. Still, I decided, you know what? I'm not taking this shot Monday morning. Just going to leave it alone. I'll continue taking the Lantus, although, I don't know really what that's doing anyway, but, I guess it has kept my glucose pretty even, pretty steady when I'm not eating. If I eat something, it does jump up, then it comes down, and overnight it's been dropping to between 110 and 100, which is not necessarily making me feel super comfortable, but at least I haven't crashed since I stopped taking the Trulicity. Now here's the thing. I should know better. Been in healthcare over 40 years. Yes, I was mainly on the financial side, but I had to take care of my mother for a whole bunch of years. And it's just one of those kind of things where when I had a previous regular doctor, because the doctor I have now, we talk all the time. But when I had the doctor before that, I asked him all kinds of questions, which is probably how come he overcharged me. But I'm not going to get into that now because he upcoded and I ended up having to pay him more money. Still, I just want to let everybody know. I want to warn everybody. I want to give this little bit of advice. When doctors are telling you new stuff, whether it's with medication, whether it's a procedure, whether they want you to start stretching a little bit more or whatever else, and if they really don't tell you why you're doing it, you need to ask if you're worried about it. Even if you're not worried about it, you probably should ask, because I should have asked. That was just stupid of me. If someone else that I knew who might have been a nurse or whatever said, hey, you should, reduce this or do whatever, I would have asked questions. I should have asked questions of the doctor. I certainly always ask questions of the nurse manager, but I should have asked these questions. So what has happened in just, 3 or 4 days? I am eating. I'm not splurging, but I'm eating stuff. I feel better. I have not had any nausea. I have not gotten on a scale yet to weigh myself because, it's only 3 days. And I usually only weigh myself every couple of weeks. But I feel better. And I don't know what they're going to say when I finally do talk to someone. I did do a search on YouTube, and there was this doctor who was talking about it. And one of the things he mentioned is that, you should probably ease your way up, try to eat a little bit at a time so that you will get used to it before they increase the dosage. I'm thinking, I don't want to increase the dosage. I don't want to take this stuff anymore. Maybe that's an overreaction, but that's just my thought. So that's my thought. That's what happened to me. It obviously doesn't happen to everybody, but it's, it's a red flag thing. I'm telling you, I thought it was rough enough getting older without having to worry about some of these other things, but that's just life. Anyway, I'd like to know what you think. I want to know if there's any other diabetics out there who may have tried Trulicity and they've decided that, they're going to continue taking it because they don't mind the weight loss. They're scared to take it because of the weight loss. They're scared to take it because they lost appetite. Did you talk to your doctors? I'd like to know. Anyway, my name is Mitch Mitchell. I hope y'all have a wonderful day.